Thayne Bosh with Kitsap Physical Therapy, and I'd like to spend a little bit of time today talking to you about our post-op special interest group. The post-op group was formed a couple years ago by a group of therapists within our practice that wanted to ensure that we were giving our post-op patients the best quality care that we possibly could. We decided that to be a part of this group, you had to be an orthopedic clinical specialist, and you had to attend quarterly meetings within the group, present on current topics and literature out in the field, and make sure that from a quality assurance standpoint, each clinician in our clinics and each clinic collectively was using the most up-to-date protocols and research-driven, scientifically driven information to help treat our patients. What this has allowed us to do is really focus on educating patients on the safest practices to be doing directly after surgery and throughout the rehab process, and allows us to then improve our outcomes for those patients to get them back to doing what they want to do functionally, make sure their strength and range of motion returns so that they can get back to doing life as they want to, as quickly as possible. We know that these patients, they don't do surgery because they don't want to get back to 100% the way they were before. So it's important that we help them do that as quickly as effectively as possible. It also allows us to prioritize our post-op patients to make sure that they get in for their physical therapy in a timely fashion directly after surgery, which is extremely important to get people moving and make sure that we get those questions answered and get into these protocols in the appropriate time frames so that we can achieve those outcomes and goals. It allows us to then effectively communicate better with their surgeon through the patient and through our own direct lines of communication. It's even led us to great communication outside of the clinic with the surgeon, develop those relationships, which only helps our patients get better faster. So whether you've had a total joint replacement, a total shoulder, total knee, or you've had a rotator cuff repair, a hip labral repair, shoulder labrum repair, slap repair, or even spine surgeries or fusions, simple meniscus surgeries in the knee, or an ACL reconstruction. Please know that you can come see one of our post-op specialists here at any one of our Kitsap Physical Therapy clinics, or you can ensure or be guaranteed that any one of our clinicians at any of our clinics will be up to date with the current, most appropriate rehab plans for you to get you back to doing what you want to do. Thank you.